Miss Edie, you're still muted. I can't hear you. Uh-oh. Is anybody else muted? Is she muted?
No, yeah, I can't hear you. There we go.
Good morning. Can you hear me?
No.
Now we can.
Thank you so much. I apologize. I mentioned, as you may have figured out, Jerfa, who is our grad student, she's typically with me and keeping me in order. Unfortunately, she had an emergency this morning, so I'm pulling some things together. However, we are well. Thank you for joining June's edition of Beyond the Gift Card. Please note the meeting will be recorded. Welcome to everyone who has registered, who is here in person, who will watch this recording later, and who will also attend later. We'll go to the next slide. Beyond the Gift Card Community Conversations. So for those who may not know me, my name is Edie Taylor Criddle, and I'm the founder of Healthy Communities Coalition. And we decided, in partnership with many others, to launch a community conversation series that addressed research how we use it as community and faith-based organizations. So these conversations you'll find are shaped around 4 pillars. This is our June conversation, and we launched the series in March. We started with just an overall view of research, connecting the dots between research, the academic institutions, and the communities on the ground who are the first responders in doing any kind of work that impacts health in the communities we serve. These 4 pillars are outlined. The first was research and program design. The second was research and evaluation. Last month, that was last month's, and both of these series are available on our website. You can look at the video from last month's in particular. And this month, we are excited to talk about data. It is Data Day. Research and data use, data collection, and data analysis. So as we looked at these four pillars, we wanted to address how communities are using it so that we understand. We are actually researchers. However, instead of calling our research studies, we're calling them interventions. We're calling them programs. We're calling them services. We're calling them ministries. In this research, we've also highlighted on this very last pillar, the evaluation metrics that we're looking at and sort of the purpose behind these sessions. I'm going to go to the next slide just to highlight these 3, because I'm always asked, why are we doing the conversations? You know, sort of, especially in this community hosted environment, why the need for the conversations? So I wanted to just really put these 3 goals and the purposes of these conversations on one slide. We want to create a community hosted safe space for transparent conversations among researchers, other stakeholders, consultants, and community and faith-based organizations. We want to also prepare our community and faith-based organizations to equitably participate in academic community research partnerships. And ultimately, we want to prepare community and faith-based organizations to begin to drive our own research based on our understanding of who we serve, the needs, and any gaps in services that we want to address. So typically, we would start off with conversation starters, a couple of questions. But before we do that, I'd like to extend to everyone in attendance, I'd love to learn your why. What drew you to this conversation around data? And if this isn't your first time, or if it is your first time, what drew you to the series or the conversation? That would help us in gathering data as well, and also ensure that these conversations that we're preparing are meeting your needs. And that's really the ultimate goal here. This project, as many may or may not know, it is absolutely a voluntarily labor of love. It's not grant funded, but it's needed. So like many community-based leaders, you see a need and you fill it. So that is what we're attempting to do. We're attempting to share knowledge, connect people, and connect resources. So let's take a look at our conversation starters. As you take a look at those, I want to introduce our featured guests who I'm very excited to have with us. We have Dr. James Miles, who is the senior partner at the Resilient Village Collective. He's held many positions from enterprise systems analyst and program manager to chief operating officer and management consultant. His work primarily focuses on community revitalization, wellness and resilience, organizational development, and sustainable local economy practices. His professional experience includes the design pilot of a prevention and wellness care delivery model for Cook County, Illinois, the design and launch of community economic development collaboratives, personnel responsibilities for over 100 employees, management responsibilities for over 1,000 volunteers, and budget responsibilities exceeding $10 million. So we are very grateful to have Dr. Miles with us today to share his insight, his expertise. And we also have Joy Washington. Joy is a community engaged research consultant who helps organizations successfully implement community engaged research strategies. She's a thought partner, and she's the host of the Public Health Joy podcast. In 2020, Joy, she committed her 18 years of research experience into the launch of Joy Washington Consulting. It's a public health research firm dedicated to transforming public health research to positive community impact. She describes the purpose of her organization as transforming public health research into life-changing public health solutions that bring joy to the communities served. So welcome, Joy. So we want to start with research and data collection. And if you don't mind, I would love to frame our conversation around this fictitious organization, ABC Fit Inc. Okay, so while it's a fictitious organization, I will tell you that it does carry some very, I'll tell you that some of the experiences across organizations that I've worked with and that I've seen are represented in this fictitious example. So they offer a year-round youth program. They're doing teaching young people ages 8 to 18, everything from exercise and nutrition. They also have a mentoring component. They do after-school tutoring, and they have summer camp. They are currently reporting on attendance data. They're really just concerned with who's showing up. And so as I revisit our conversation starters, my first question to our guest presenters are, how can this organization use existing data to improve its programs and services? And what key information do you believe is essential for this type of organization offering these services to collect? And we can start anywhere we'd like to start. I think Dr. Miles doesn't have his, you're not muted. So great, you're already on.
Well, hello. Thank you for having me. Glad to be here with everyone. Just listening to what you just said, Edie, I would say that collecting attendance data is great, but it needs to be connected. This ideal of validity, why am I collecting this and what is it telling me? And then reliability, is it consistent? So not just are they showing up, but what programs are they showing up for, and how that what trends do I see? So I'd want to be able to look at those things. It's just as a start, just from what you said right off the bat. So getting a little bit clear about why I'm collecting this and how I want to use it will help me understand what other steps I need to take in that collection.
Oh, you're muted. Were you calling on me to go next? Okay. I think for me, I definitely agree with what was just said. The other thing that comes to mind for me is really understanding the difference between research and evaluation. What is the purpose behind collecting the data. And so if the true purpose is to do evaluation, a lot of times when we are working with community-based organizations, we're doing evaluation, which is we're using the data to look at the quality of the program, right? And we're going to use the data to make decisions about how we can improve the quality of the program. That's going to be different than research when we are looking and seeking for new information or new knowledge around something. So I think it's really important to have a clear idea of what is the purpose of this data that's being collected. And so, for instance, if the purpose is to do a program evaluation, then we're going to need some more information. The attendance data is important. It's a good starter, but we're also going to want to know more information. How are the children's exercise or physical activity or nutrition, how is it changing across time? How effective is the program? Is it changing knowledge? Is it changing behavior? Is it changing skills? So those would be some of the things that I think about. And it also says a mentoring component as well, right? So there may be some data that we want to collect around the mentoring piece, the people who are actually doing the mentoring. Are they getting the skills that they need to be able to do the mentoring piece? Same thing for the after school tutoring, for the summer camp. These are all different components that may need data to be collected in order to improve those different pieces of the program over time.
Absolutely. Thank you. Yeah, this, as I mentioned, this really happened. This scenario happens quite often. And I think because we simply, as community-based organizations, we sometimes have limited capacity, and we believe that if they're showing up, this is great, but as you mentioned, if we're pursuing funding, and if we also want to see the true value of our program, then we have to be able to identify what types of information we're collecting to tell the story. Right. Do you want to add anything else, Dr. Miles?
Yeah, there's also it's really important to understand how we're collecting it and whether it's accessible or not. So I can collect a ton of data, but if I can't access it, if I can't use it, and like in this case, if I'm just reporting attendance, and I agree with Ms. Washington, there's that's what I meant by the reliability and validity. Why am I collecting it? How, for what, to what end? And then is it in a form that I could readily use, not just to tell me whether they're there, but that I can slice across the data? Because who knows, down the road, there may be a question that would come up that won't be readily clear just looking at attendance. And if I collect the data with enough information around it, kind of the who, what, when, where, whys of that, then I'm able to do a little slicing and dicing in my data set and make it a lot more functional, and therefore have better ownership.
Absolutely. Are there any data collection methods that you would recommend for grassroots organizations who aren't, just aren't familiar with how valuable the role of data is and the stories that data can tell?
There are quite a few, there are quite a few data tools. I'm really cautious about just throwing out a tool without better understanding both the capacity of the organization and their interests. What's their temperament? But I would dare say that if it's just simple and straightforward, I use an Excel spreadsheet. But because a lot of times, and why I say that is, as a starting point, you can then extract that and import it into a tool. Like if you're going into more of a academic or a stronger one, a MaxQDA, or there's a lot of tools and data sets that can allow you to import that. But it starts with really understanding what you want to collect, why you want to collect it, what your growth goals are, and just have it in a format and understand that, and then probably get some consultation from someone who does this, because they can help you up front and save you money, time, and frustration later.
Great, thank you. There's a question here in the chat. How do you craft data to determine efficacy of a program in real time to adjust for maximum benefit?
I was also I'll address that question as well. Go back to the previous question about the tools and ways to collect data, and this might help relate to this question as well. But I think it also depends on your audience and who your participants are. Excel spreadsheets are great, but also thinking about especially in this example, if you are working with children, right? Children might not know how to complete a survey, right? Or something like that. So you can get more innovative and creative around what data looks like. Data doesn't always look like numbers. It might be, what snacks are the children choosing now? What are they? It might be an observational type thing, right? Your mentors or whoever the adults are might be doing observations of what the children are doing differently. In terms of their exercise, are they being more active? You might have a focus group or what we like to call them community conversations, similar to what we're doing now, right? Having a community conversation with your mentors or with your tutors. You could also have your mentors or your tutors or even the children, depending on what age they are, to journal. Qualitative data is just as important as the quantitative data. So there are a lot of different creative opportunities that you could look at to determine. And once again, that depends on what your specific situation or circumstance is, right? So I would definitely say for the tools piece to think more outside the box. And, of course, getting a consultant is important because they will be able to tell you the things similar to what I just told you and look at your specific situation and see what would work best for you. In terms of crafting the data to determine the efficacy of a program, that's really going to depend on your intentions, what type of methods you're using. And I think the word that I'm kind of focused on is craft the data. So the data you collect is more going to be about crafting the story depending on the data as opposed to crafting the data itself, right? Because the data is the data. It is what it is. But what you can do is use that data to craft a story. And depending on what that story is, that's going to tell you how effective that program is. So if you're using journals or if the kids are drawing pictures or whatever that is, you can look at that data and you can determine if there's something that you need to switch up. A lot of times when we're doing community-based research, you might put a survey out there and it doesn't work, right? So you got to figure out what is the best tool. How do we shift things? And that's part of that real-time effect, right? How are you going to be determining the efficacy of the program in real time? So appropriate for the group that you're working with. And that's going to help to adjust for that maximum benefit. So you're going to have measures in place. And I like to tell people all the time, have a document somewhere where you have a list of your lessons learned. That is data. Okay, you make a list of the things that you're learning along the way, and you're capturing in real time the data of what's working and what's not working, and how you've shifted, how you've pivoted, and what needs to change. So that would be my response to both of those questions.
Great,
I'd love
thank
to
you.
throw in okay.
Go ahead. No, go ahead.
I'd love to
Dr.
throw an
Martin.
example in there. We were working with a group of, there was a group that serves military connected children. So these are children of service members, and some of them pretty young. So we were teaching them about self-regulation and stress management. We had some tools that could allow them to really collect data on their own heart rate variability. That sounds real complicated, but here's what got simple. We worked with the teachers, so we collected data on how the teachers and facilitators did with understanding the tools and presenting it. Then there was another level of data, just, were the kids there at the sessions? How did they enjoy it or not? And that was just some feedback, and I was loving, what Ms. Washington is saying about the different ways to collect. We call it bricolage. I might be saying that French word the wrong way, but where you can collect data from many different sources. So example, the kids as young as some of them were kindergarten in first grade, where they went home and they had to share what they were learning with their parents. And then they used a app called Flip Up or Flip something that you can record videos, from the phone. So then they recorded a video in their own words that they brought back in. So now we had these videos along with this feedback from their parents. That was wonderful data, because now we not only saw their own artistic expression, but we heard them calling out what they were learning, how they were using it, what they wanted to do. And that became almost invaluable in being able to communicate the efficacy of that program. Were we actually reaching the goals of what we wanted those kids to understand? And that we wouldn't have gotten that with the survey.
Absolutely. Thank you. Absolutely. So I love that you pointed out just various, various points where data can be collected in addition, of course, to this attendance data. You've talked about various methods to use that you've used in your example, but also that if you're running a program with youth, you can obtain this data directly from them, but also from their parents as well, and from their teachers as well. Great. So let's look at the next slide. Oh, Joy, I wanted to apologize to you. I'm still improving my moderating skills. Okay, but I forgot to come back to you.
Oh, no, you're fine. You're good. And there's
Thank you.
a question in the chat too.
Okay, thank you. So let's, I'll grab that. And it is, do you have a list of independent researchers that would be available for nonprofit organizations? So yes, hi, Ms. Josephine. Please hold on to that question for me, because that's part of our Profile Erase initiative. And actually, Joy, of course, certainly is a great consultant who's available, but we will have a list. There actually will be a database. There's currently a database, but we need profiles to be added to that database so we can, best pair researchers and consultants with nonprofit organizations who are seeking assistance. Let's move on to, yes. Okay, let's move on.
I have a follow-up, but I'll wait till
sure.
it's appropriate.
Okay, thank you.
Okay, thanks. All right.
Let's move on to the research and data use and analysis using looking at that same model, that organization. So if we're looking at attendance data for this organization, and again, it is fictitious, 50 youth are enrolled, but we wanted to take a look at 2 months of sample data. What does this data say? That's really the question. And there is no right or wrong answer. I certainly understand that. And we have to put things in context. So I guess, what could this data say? And this is for anyone. You can put your responses in the chat, or also, of course, for Dr. Miles or Joy to chime in, because this is what we're looking at. Only looking at the attendance alone, this one metric. What could this data say about the program? What could we learn from it?
Just from what I see, that there's an increase in youth attendance with programming from January to February. So there's something that took place where the kids felt more engaged and continue to come back, which is a good thing. But what is it that actually took place?
Absolutely. And without those other metrics, it's hard to determine that if you're only looking at attendance. Are there any recommendations, Dr. Miles or Joy, just around sort of how we can interpret our data, or where you would start to look at this? Or is it not enough, simply not enough to glean anything?
Yeah, I would say for me, because of my mindset, the first thing I'm looking at is all the things that could be in there, right? It's not in there. But of course, starting with just grabbing the attendance is great. And we can see that from month 1 to month 2, it looks like that it has increased some, right? But it leaves a lot of questions. So even with attendance, what ages? It just says youth attended. So what ages did everybody attend every single day of the week, or every time the program was offered? Was there a student who came to or a young person who came to every single one versus someone who didn't? When they came, what did they do? Right? I think somebody mentioned that earlier. What did they do? how long did they stay there when they attended? If the program is 4 hours, did they stay the entire 4 hours? Were they engaged the entire 4 hours? So there are a lot of questions, even just with the attendance piece, that we could break down even further. Was it mostly, what were the gender of the students that came? You know, was the programs tailored to a specific gender or age group or whatever? So those are some things that come to my mind when I see the data presented in this way.
Mhm.
Building on that, and loving that, they're also the week-to-week numbers suggest that even though it's a minor fluctuation, why is week 2 the higher number in both cases? And that, you know, that you have this up, this down, up, trend. Are they the same kids? You know, is this just a matter of a particular family or a particular group? Is there something else? But you see those trends there, and is it you know, as was already stated, is it connected to particular nuances on how we're delivering programming? So that could have, are there certain instructors, facilitators available that the kids or the participants attached to? So it raises great questions, and if nothing else, to ask the organization themselves to tell me what this says to them. And that alone could start the path to both collectively unpacking it and in a sustainable way where they can own their own data. We collect data and allow helicopter folks to jump in, grab it, and go do things with it. And then the value of the data is now lost to the organization.
Mhm.
And
So,
so,
okay, I'm sorry, Dr. Miles, can you clarify? Because I just want to make certain that we all understand your term helicopter folks.
so a lot of times, in both my doctorates, I had advisors that basically said to me, what we do is we go in and watch people who are really doing the real work, and then we put it into terms and numbers, and then go out and present it and sell it, and et cetera. And so helicopter folks sometimes are those who really aren't vested or engaged in the community and aren't really partnering, but they're collecting the data, then they take it and go with whatever interpretations are used. And then you're
Mhm.
chasing after that narrative. And sometimes even the data. Sometimes groups don't even own their own data when it's done that way. So it could be an outside organization. Then we also have groups that are chasing dollars versus really anchoring programs. And then those organizations are telling you what you can or can't do, and your data is all over the place, you know, over for long term. So the ideal of a helicopter person, someone who's come in not really vested and not necessarily looking at the long-term value for the organization or the participants in that data, and they're gone.
Absolutely. Wow. I think the points that everyone has raised, which is so powerful, even in how you're looking at this, data. And when we think about those helicopter folk that you reference, so if they understand how to interpret our data, then it's just so much more important that we have these types of conversations, so that we understand what our own data says. And then we absolutely know how to respond in kind to that, whether that means adjusting the program, whether that means doing more, adjusting it to add another service, whether it means partnering with another organization who adds a complementary service and not feeling like we have to offer everything to our constituents and to our communities. Ms. Josephine, did you want to add something?
Yeah, I'm sorry I came in late, but I guess I'm concerned is that sounds like that there's a group of experts that do this work, and I don't know how many community people know about the experts, because the problem is that I think I shared it with you before, is that people are very wary of researchers, and there's so many grants now that require you to do research, and you have to, in order to get the grant, you have to do research. And I was wondering, I was talking with a colleague who was really concerned about researchers that are tied to universities. So I just want to know if the people that are part of your group, are they independent researchers, or are they representatives of universities that get data and I've heard this before, they get it, they never share it, and they, they get their dissertations and their PhDs and major grants. So I just want to know, and I know we had a conversation I've been missing for a while, but I'm just concerned that it would be great if we could hold some convenings with, or at least have a list of places that when people are doing grants, they could say, oh, I could contact this African-American researcher who is full of integrity and is going to give me the data I need and is not going to sell it to the university. And I don't look at it and somebody's done a book and I didn't even know so that's kind of what, or they do these studies and they never share it with the community. It's just a lot of issues. So I just think it's a frontier that needs to be developed more. So.
Absolutely. Dr. Miles LaJoy, do you want to respond to any piece of that before I respond?
I'll share my instinctive. Joy, go ahead. I saw you come off mute. I'll wait for you.
Oh, no, I was just gonna mention that point is very valid. And that is one of the exact reasons why I do have my PhD. And that's one of the exact reasons I decided to start my own consulting agency, was to move away from academia and be able to provide support directly to communities so that you don't have to go through the red tape of the university and the barriers of the university and those things like that. And I even see someone in the chat mention about, there may be some advantages, right, to working with a university because of the IRB process that's required. But what sometimes a lot of people don't know is you don't have to go through the university to do the IRB process, right? You can go through private IRBs as well. And so having someone who is not only a researcher, but is also an advocate for you and for your community is going to be very important. So there are some of us out here who are not tied to the university and who can make sure that your research, you have ownership over your research and your data, and that you are the one who is in charge of that. And we're here to support you more so as facilitators more than anything else in the process.
And I'd say, just like Dr. Washington here, there are a lot of really good-hearted folks out here ready to pitch in and help. I don't do this consulting unless I have to. I do the work in my own organization. But here's the thing. One of the things we can do is become a little bit more informed. We can be super intentional that there's somebody on the team, preferably in senior leadership, maybe a couple. You don't have to become this, researcher extraordinaire, but just understand what is participatory research. What is, what is grounded theory? There's some basic things that we can understand, the basic tools. Why do I want an evaluator up front at the point that I'm designing the program versus adding them later?
Exactly.
And there's things like that. If we can just get that thinking, I dare say we could have, even in this organization, some of these youth could be junior researchers and would teach us things. And so we can do that. We can do it without feeling like you had to all of a sudden go and swallow the worst tasting medicine in the world. You can really get the basics and start playing around and then call in the experts to augment that growth. That would be a wonderful start and wouldn't be that much to do to just get more awareness going.
I think the piece that I like to add, well, there are two pieces. So I want to be clear that we are open to working with community-minded researchers, whether they are attached to the university or not. I wanted to make that clarification because we just need people who are, who have the heart of the community. And we can't, I'll speak for me personally. I don't decide to fault them because of their employer. I understand that. I understand they have deliverables to meet as well. But I also appreciate and respect those who just step out because they're so passionate and they really want this work done how they want it done in the right manner. And they create their own. So I certainly see both sides. But I also want to acknowledge that we are, when I say we, I mean anyone who's working in the community through your nonprofits, we are researchers. We've been labeled at different levels, but we are civic researchers who are implementing interventions every day. all of these programs that we're doing, the after-school programs, I mean, any programs that we're doing, workforce development, things with parents, we are conducting research, but we're calling it programs, services, and ministries, and not realizing that this is an intervention. And we're simply learning how to convey the value of what we're doing and convey it in research terms, or be equitable partners in research partnerships and drive our own research. So part of the charge of these conversations is to get us thinking in that mindset and looking at data like that. Because who would think, really, unless you're used to looking at this, that this one slide about attendance, that you could garner so much information and so many questions around. All the questions that Joy and that Dr. Miles kind of suggested, help us identify these different data points that we should
Oh,
be.
There's an example. I just finished up a project with patient-centered outcome research, PCORI. We were working with a faith-based network, and there was a professor out of UIC that created a human subjects research training platform that everybody in the program went through. It was about 6 hours of training. So then they became human subjects research required by IRB. And so this was to create a citizen scientist who can then design interventions for their community. And that was a wonderful example. And things are going on. And I can, Edie, I can get you information about that training.
Okay, perfect.
But those
Thank
are
you.
examples where everyday folks are getting a hold and getting some training, getting exposed, and then becoming the ones designing the intervention.
Absolutely. Which is where the real money is, right? It really is. It's equitable dollars.
Yeah.
There are research is $1 billion industry. Would I be correct in saying that?
Easily.
And we're
Right.
already on the ground doing the work. So I'm going to move on to the next slide, which just sort of speaks to these types of outcomes that we could report if we were looking at those metrics that Dr. Washington and Dr. Miles just shared earlier. If we looked at each component of your program and developed some data points, and again, this is just it's simulated information. There's simulated data that we can look at. So this slide just shows the exercise habits, the nutrition habits. Let's look at the next. So of things that you could measure. So, oh, good, we are right on time. It's 11:40. Dr. Miles or Dr. Washington, do you want to add anything based on these slides? And then we'll open the floor for general question and answer.
I think this ties back to how you collect the data, making sure that it's useful. We have a project where we collect data on like this on people, how they're measuring their own heart-brain connection, how that's helping them show up, perform better. There's a lot of subjective and relational data there, and we need to collect it in a way, one, that the people want to send it in, or you find that your database is not that useful if you don't have enough consistency in data inputs. So that just the way to collect it, using best practices, and then making it so that it's meaningful to the participants is really a big thing I see in what you're showing here.
And I just wanted to mention, I also wanted to recognize, I think somebody had a hand up earlier. I think it was Cher.
Thank you. Okay. I'm sorry.
If I'm not pronouncing the name correctly.
Cher J. Okay. I'm sorry, Cher. It's just me. And Dr. Washington is helping. Okay. Please come off mute.
I thought we were running out of time, so I was like, let me just lower my hand and just listen, maybe it's slides because I came in late because I was having, never mind, long story. But what I was gonna say, the other, what I think her last name is Guider, Miss Guider is putting in the chat about, is there an instructor involved? And like, as a civic researcher, I tend to be that person with the nitty bitty details. So not just, oh, this increased, Is there, like what Miss Janice is saying, is there a different instructor each week? Is there a person in the community that is pulling those people in? So we have a different way of relating to our folk and community than, like, say, a big university model, or people that come into our community to do things. We're able to kind of engage people based on familiarity. So if there's a pastor in the neighborhood that can gather people, if there is a group of young people that said, that 50 people in that 1 week could have been called, and it increased just because they had a robocall. Or it could be one particular youth that the children admire that come to the program because of it, but that can also inform. So some of the things people were saying about kind of deputizing young people or deputizing community members to be able to figure out this research on their own, but not in a direct way. Because a lot of, like, I know, as in social science research, you ask one question, but you get like 100 questions from it. That question you ask has nothing to do with what you're really trying to get, you know. And so I just wanted just to add that piece, you know, that we're able to dig in a little bit deeper and should use it to our advantage.
Absolutely.
So it goes in line with what people are saying about having the resources. And it may have to be like it was a long time ago, where we really called each other on the phone and asked questions about things and start talking to people. Because we're Black people, you cannot come into my house and go right to my refrigerator. You just can't. And that's, a lot of times we're like, oh, we have these degrees and this experience, and we go into communities and we kind of come off like the same people we're trying to not be like, you know. But sometimes, like, you got to throw that thing out the window, and come about it a whole other way, and just be ready. Like Mr. Miles says, it'll change right there while you're there. And like Miss Washington said, you have to, like, have, you know, different things in order. Can't be stagnant, because it may not be appropriate. It may, you know, yeah. So that's all I wanted to say. I didn't want to take so much time. Thank you.
I'd love to add a quick point that those are also data points. Those key junctures, and learning how that plays out in a particular, all communities, even our own, are not the same. And just getting in there and sitting with it and learning from the folks is just huge. And that alone becomes process and impact. So I love you saying that, Sharon.
Okay. So I think we are moving into question and answer, which we already are there. Well, actually, no, we're not. Actually, so for this organization, I do want to add this at each conversation. Can you identify any potential research opportunities for an organization, for this ABC Fit, who's running these programs, who have 50 youth, and we saw the attendance numbers? Any potential research opportunities as we think about being a leader of this organization who's not thinking about research and who's hesitant to even talk to a researcher? Are there potential opportunities for that leader to create something to measure? I hope that makes sense. Does it?
Absolutely. If this
Okay.
program has 50 children, I'm going to assume, unless it's a super micro community, there's another 50, 100 other kids. So why are these kids coming to this program? What are they getting out of it? And how can that then become a bridge either for my program to grow, or how can I bring other collaborators in who have the same heart and mind to work with these others? That's a research opportunity right there. And that's good, as collaborative, ground up, and participatory, to really get at the meat of that for it to be sustainable.
Yeah, and I'll also add, one of the things that I was thinking about was in this youth program, there are certain things that are a little bit more controlled, right? But then you have all the different external factors that's going to impact that child or that family or that household. We talk a lot about social determinants of health, right? Community determinants of health. We're talking about nutrition and physical exercise. Yeah, you might be feeding the youth an apple, you know, for snack time, but then they go home and they have something that may not be as healthy, right? Or may have something that is different that they're used to, that works for their family and for their household, that might be totally different than whatever you're teaching in this program, right? So we have to start thinking about that, even when it comes to physical exercise and activity. Okay, yeah, they get physical exercise and activity while they're in the program, but then when they go home, they might not have a park or green space or a basketball court or a walking track or a safe place to play or anything like that. So I think those could be some potential opportunities there as well. I work with a lot of communities and doing what we call a community assessment, right? How do we assess the world around them, first of all, to see what's happening, what's going on, because what we do in this program is going to be different than what happens when they go back home or when they go back to the world that they live in, whatever that might look like. So I definitely think that there are some opportunities there as well to collect data around what are some of those external factors that may be impacting their world, their household, where they live, work, play, where parents work. You know, a lot of parents, they got to work past 5, or they might be working the night shift, or whatever. They might not have time to take their kid out, or to fix what some might determine might be a healthy dinner, or whatever that case might be. So I think that's something to consider as well.
Absolutely.
There's a friendly framework that's anchored out of DePaul, and John Ziegler, I know, is one of the key folks out of the Egan Center there, and it's asset-based community development. It's a wonderful framework that really is ground up, and it invites people to just understand themselves and everything around them as resources and how you can leverage that towards an end. So that would be a nice starting point. There's many others, but that would be a nice starting point if for those who are just looking for some framework they may not already have.
Okay, great.
And I'll also add one in the chat that I use frequently. It's called Community Toolbox. I'll put the link in the chat, but they have several resources on things related to frameworks and evaluation or research assessment, how to build these relationships, sustainability. Like, it is my absolute go-to, and it's a free resource. It's available online. So I'll drop that in the chat.
Thank you. Thank you. Thank you. Wow, time really flies. The hour always goes by quickly. Let's see. Are there any other final questions and answers as we begin to wrap up during our last 10 minutes? I know great. Hi, Janice, please come off mute.
I really do apologize for not being on camera, but I'm having a really bad hair day here.
All right.
I live in a predominantly white community, and we are, I'll say what it is, DuPage, and we have been determined by the Kellogg Foundation to be the healthiest community in Illinois, yet over 2 triennial community health analyses, African-American Black people consistently have the worst health outcomes here, mortality and morbidity. I'm working with a group now here, trying to get them to understand the value of evaluations so that we're not just doing programs. Edie, was it you who said this is a billion-dollar industry? Yes, it is. And I apologize if anyone white is on this call, but you know why they do this? They figured it out. And I'm hoping that we can figure this out too, to get to our people the resources we need to improve our health and education outcomes. And lastly, let me say this. If we are, and we should use people in the community to help with this work, we've got to train them. I recently tried to get our community to commit to a conversation with our healthcare leaders about what are they going to do to improve health delivery in this county. And it was an untrained, and sadly enough, a member of the NAACP who went on a diatribe for about 5 to 7 minutes, wanting to convince all of these white people that Black people are to blame for our poor health outcomes. Can you imagine my heartbreak, which changed the conversation from addressing health disparities to how to have safe conversations, because I had to cut her off and say, and I politely did it, but said, let's give other people a chance to have a time to speak, because my time is limited as the presenter. Her response to me was, I feel like you disrespected me. And in private, she said, why when you're talking about Black people, you don't sound like a Black person? I cannot figure that out. I said, I am giving data in the most objective way that I can. All of that to say this: if we're going to use, and we should, community members, people who look like us, we've got to give them some kind of training, because they can come in and mess up. And that's what this young lady did, not intentionally, but uninformed, and gave the people in that meeting who had the power to say, yes, we need to address this, gave them a segue to say, for the next 3 meetings, let's talk about how to have nice meetings, safe conversations. What a waste. And then they paid somebody who doesn't look like us thousands of dollars to come in and lead the meeting. I mean, you get my point? I actually started my own nonprofit because I want to know more about what you guys are talking about. I hope we can meet on a regular basis to iron out and flesh out some of the issues that we're running into. But we have got to look at, how do we take this billion-dollar industry and shift and use it to shift the paradigm of our young people and our families and our communities, so that we too will have opportunities for optimal health and education outcomes. I've enjoyed this immensely. Thank you, Edie, for sending me that reminder, and I hope we are going to do this on a regular basis.
Thank you so much. Do either of you, Dr. Miles or Dr. Washington, have an immediate reaction?
Yeah, Illinois has, I'm sorry, Dr. Washington, go ahead.
No, go ahead.
Illinois, there's a SHARSHIP, State Health Improvement and Planning Commission. It's out of the Department of Public Health. I was on that commission and then I had to step away, but they particularly are looking at health practices across the state. And so DuPage was represented in there. So I just put a link to it, to their overall study, but it's being anchored out of the School of Public Health at UIC and the Department of Public Health. She might be able to make some calls in there and actually talk to the people who can give her more resources directly on what's going on right now to try to pull it out, because equity was one of the key issues in this last 2 years. So that link for the SHARSHIP is there as a starting point.
Yeah, and I was just gonna mention, I put something in the chat, Community Research Fellows Training. If you Google, there's not a particular link for it because everybody does it different across the nation. But if you Google Community Research Fellows Training, you will see that different organizations or different universities have specific programs to train community members in research. Also also independent consultants like myself offer research and data literacy training for community members that can be customized and tailored to your needs. And I'm from Mississippi. I don't know if everybody on the call is out of Illinois. We got people from different places, but I'm from Mississippi, so I'm way down. And we have a community research fellows training, and it's a I want to say 10 to 15 week program, depending on how they do it from time to time, where we are literally working with folks to do training, of course. And there are other organizations. I know Black Researchers Collective is another one. There's also other avenues to get this information. So I know Black Researchers Collective, they have a podcast. I believe it's called Researching the Streets, I think.
Yes, yes.
My podcast, the Public Health Joy podcast, is where we're having these safe spaces, right, for these conversations around what this really looks like doing this work in communities. So this is there are definitely resources out there for sure.
Absolutely. So as we're wrapping up, there are also opportunities to stay connected to the coalition. I referenced the Project Erase profiles, so please scan the code. This just gives us basic information on your experience with research. If you are operating a nonprofit, we also ask questions regarding the population served. And if you're a researcher, we ask questions regarding your interests so that we can facilitate the best connections. And then lastly, join the movement to stay connected to us. You can join the Research Advisory Committee. You can be a panelist or presenter as well. And last but not least, because we are talking about data and research, please take a moment to scan the QR code to complete this very short evaluation. I'm sure that Dr. Miles and Dr. Washington, please share your contact information for people to stay in contact with you. I know you can be found on LinkedIn, but are there any other direct connects you would like to share?
Yes, I did put it in the chat earlier. I'll post
Okay.
it again. So my website is joywashington.com. You can also reach me by email, info@joywashington.com. I will also drop my LinkedIn profile in the chat. You can feel free to connect with me there as well. But those are going to be the primary ways to connect with me.
Thank you. Thank you so much for joining us, Dr. Washington, Dr. Miles, and everyone else who took time out of your day. I really appreciate it. I appreciate you validating the need for these types of community-hosted conversations and joining us. And I look forward to growing together with you.
Look forward to hearing from everybody if you want to reach out. Thank you so much for involving me.
Thank you.
Absolutely. Thank you. Have a wonderful day.
Can you send out the links? Because they went so quick, so the system will only allow you to do one at a time when you scan it with your computer. I mean, with your phone. And
okay,
then
okay.
everybody's their contact information in the email. If you could send that out, that'd be great.
I will. Okay. I
Thank
certainly will. All the attendees. You're welcome. Thank you. Well, you guys have a wonderful day. Enjoy.
Take care now.
Thank you.